Do you struggle with hand complaints? And by hand complaints, I mean complaints in terms of your fingers, your thumb, or the palm of your hand. This may be tendonitis, it may be trigger finger, it may be just pins and needles in your fingers, or something that's never been formally diagnosed from a health professional. If you do and you're an office worker, there's every chance that something that you're doing while you're sitting at your desk all day may be the cause of these hand complaints. The hand complaints that you experience may not be occurring whilst you're at work. You might notice it when you try and open jars in the kitchen. It might be when you try and open a car door. Hand complaints that occur outside of the office can absolutely be caused by something that you're doing inside of the office. At ERGO Collective, we believe that most people's body complaints come from their poor, static postures. And where do you do most of those? At work, of course. It's really important to consider the postural, the ergonomic, and the behavioural elements of what you do every single workday that may be contributing to the health of your hand. Let's have a bit more of a chat about the anatomy of your hand and how it's designed to work, and then go through some of the postural, behavioural, and ergonomic causes that can be contributing to chronic hand complaints. Okay, let's talk about our hand anatomy. And when I mean hand, I mean fingers, palm, and thumb, relative to how it's supposed to be over the course of a 40-hour work week. So when you talk about the anatomy of the hand, what should happen is the hand should sit nice and square relative to the wrist and the forearm. So you should be able to almost draw a line from the palm of your hand through your wrist to your elbow. So that's a really great position for the hand to be in over the course of the day. What happens is hands hate deviation. If we use shortcuts, for example, or if we use our mobile phones, for example, these are the sorts of unstable, poor positions that we can put our hand in, which creates strain and discomfort through there, which can lead to injuries down the track. So if you do struggle with thumb complaints, or finger complaints, one of the big ones that we're seeing at the moment is it's due to holding your mobile phone. Some mobile phones are really heavy and some mobile phones are very wide. And depending on your build, holding a mobile phone for excessive periods of time in a positioning like this can lead to strain patterns through your fingers or through your thumbs. So when you hold your mobile phone, it's really important to think about trying to maintain that nice straight line from your hand through your wrist into your forearm, and hold your phone with as minimal strain through your hand as possible. The other big one in terms of hand complaints are when we use shortcuts on a keyboard. What happens is when we put our little finger down and create that twist through that forearm to use shortcuts repetitively, it's that sort of anticipatory tension that we have in our hand that can lead to injuries and overuse. If you do struggle from hand issues, I would encourage you just to check your positioning when you're using your mobile phone and when you're shortcutting on the keyboard to make sure that there's no excessive deviation through that hand, which can create this vulnerability. Hands like to keep square and they like to keep straight. And if you can maintain that, most hand and thumb complaints will sort themselves out. The first ergonomic consideration in terms of hand complaints is the deviated mouse position. We've already discussed how the elbow, wrist and hand all like to stay in the same line. What happens when the mouse is deviated off to the side? What you have to do is you need to twist your wrist to accommodate that positioning, and as a result the fingers have to reach and are no longer in a straight line relative to the wrist or the forearm. This is problematic because what happens is the stress and the strain to hold and maintain that deviated position through the hand puts huge amounts of strain and tension through the tendons within your hand. If you do suffer from deviations or trigger finger, I would really encourage you to review your hand position while using the mouse. You should be able to draw a straight line from your fingers through to your wrist into your forearm. Anchoring your wrists on the desk is a behaviour that can definitely lead to hand complaints such as tendonitis. what tends to happen is when we anchor our wrist on the desk, it puts a huge amount of effort and force through the hand to do the movement of the mouse, rather than traditionally it should be your entire upper limb. When we anchor our wrist on the desk, we really have this ability to hinge through our wrist and strain through our fingers to use that mouse, which can cause hand and thumb complaints. The shortcut hand positioning is a huge problem in terms of tendonitis. If you do suffer from hand problems and you do use a lot of shortcuts over the course of the day, I would encourage you to review the positioning of your wrist relative to your hand. As you can see, when you shortcut, you put a huge amount of torsional stress through that left wrist and hand to put your fingers on the correct keys. What tends to happen is we maintain this flexed and twisted positioning even when we're no longer using the shortcuts. It is this torsional stress that you put through your hand that can lead to tendonitis through the hand and through your thumb. So it's really important that when you are not using the shortcuts, that you put your hand into a really neutral, passive positioning. The load should be square and straight through the wrist, and your fingers and your thumb should all be in good neutral positions. A behavioural consideration in terms of hand, finger and thumb complaints are the way in which we hold our mobile phone. We touched on it earlier that the hand likes to be in a really passive position. There are a number of variations of how people hold their mobile phones that can put huge amounts of strain and tension through particularly your fingers and your thumb. It's really important that you review the way that you're holding your mobile phone to make sure that there's as minimal stress as possible going through the fingers. If you do suffer from pain and discomfort in your hand whilst using your mobile phone, it's a pretty good sign of your body trying to tell you that it's not happy with the way that you're holding it. So just review the way that you're holding your mobile phone and try and keep the hand relative to wrist positioning really straight, and that you want your fingers to be as passive as possible. As you can see, how you sit at your desk over the course of a work week is really important in maintaining really good musculoskeletal health. Fundamentally, in your body, every joint, ligament, muscle, tendon, bone, it's all got a really specific role, and if you use it how it's designed to be used, generally it'll look after you. What we're hoping is there was something in this video that jumped out at you, whether it was a behavioural quirk, whether it was a poor posture, whether it was an ergonomic issue. What we're hoping is one of those things jumped out at you, and if that aligns to your body complaint, there's every chance by addressing this and fixing this, your body complaint will settle down. If that wasn't the case and you're still a little bit unsure, what I would suggest is to continually just check yourself over the course of the day. What is my head doing? Where is my elbow? What are my feet doing? If you can continually check in with your body over the course of the day, you'll actually realize that you have a lot of consistency in terms of your postures and behaviors. And if you can identify those quirks and change them, generally you'll find that your body is in a much better position. If you would like a little bit of one-on-one attention, what I would suggest is booking for a clinical assessment with one of our staff. That way we can go through all fractions of your life to try and ascertain the cause of your complaint. Sometimes it's a little bit complicated and sometimes it's not easy and straightforward. And this is where a formal clinical assessment with one of our staff is probably the best idea for you. At the end of the day, how you sit at your desk affects your body both inside of the office, but actually more importantly, what it does outside of the office. At ERGO Collective, we're your partners in office health.